All right, so let's talk healthcare.
Dan, let's talk healthcare. Who do we
Because
have?
this is, I'm reading
We're going
this.
to let Dan
pretty
do the
impressive.
introduction.
My brother Joe.
Joe.
Your brother Joe?
everyone.
And your other brother Joe?
Steve.
Joe and Steve. And I need to give a shout out to Joe at WNN because he texted me that we needed a song, and I texted him that it was Thursday, and he texted me back, oh, wait, I think it's Thursday. And there's Joe.
There's Joe.
And there's your little guy falling over. And you are all with Health Alliance Network.
Yes, we are.
Steve and Joe. You got all that? Steve and Joe. We had a lot of things going on.
I
What's
got my
Health
brother
Alliance
Joe and my
Network?
brother Joe and my brother Joe.
And my brother Steve.
Is it just two of you as brothers? You have
Yeah.
sisters?
No, I got a sister, yeah.
Do
She's
you?
right
Do you
here.
have a sister?
You got a sister. Does he
All right,
have a sister?
I have the same sister.
Who's the oldest?
I'm older.
Well, my sister's the oldest.
And you're the baby?
So you're the baby?
Stop it.
They made you the baby?
Yes,
Stop.
that would be accurate. He is the baby.
Ah, I guess it's a sad,
I'm the
sore
baby, too.
subject. We
We're
can't go
afterthoughts.
there.
So how about them Yankees?
I guess that's not a subject we touch. All right, so let's talk health and telemedicine.
Telemedicine.
What is telemedicine?
Steve, take it away.
Steve, tell
I'll
us.
start off. I just like to put him on the spot. So, Health Alliance Network is bringing telemedicine to the masses. And if you're not familiar with telemedicine, it is basically exactly what it sounds like. You will use your telephone to connect with our doctors. So, in summary, we have over 3,000 doctors nationwide. We are licensed in all 50 states and Puerto Rico. So we replace the typical sick visit to a primary care physician or urgent care, or in some cases people decide that they want to use the emergency room as their primary care physician. So typically if someone gets sick or comes down with the flu or a sinus infection, so on and so on, you can sign on to our app and be connected with one of our board certified licensed doctors. And I stress that because our company does not use any nurses or nurse practitioners. It is only board certified doctors. So instead of getting in your car, making an appointment, driving to an urgent care, make an appointment to see your primary care physician, which we all know never happens. Hi, can I see Dr. Speranza today? No, you cannot. You can see the nurse practitioner, and you can see her either tomorrow morning at 8:30 or today at 4:30, and you'll wait 2.5 hours. So now you could literally sign on to our app. A doctor will come on your phone or smart device, tablet, computer, whatever you happen to be using, and the doctor can diagnose roughly 60, 70 different conditions right through the telephone. If he or she feels that a prescription is necessary, they will call in a prescription to the pharmacy of your choice that you have already preloaded under your profile.
Now, how can they do all that telemed? You can stick out your tongue. You can't listen to your heart rate. You
Fevers.
can't look in an ear.
There are many ways. Steve?
Is there, I don't know, first of all, did you get all that? Basically,
We got
Steve,
all
get
that.
closer to the mic.
We got all that.
basically, if you want to talk to a doctor, you can pick up your phone and talk to a doctor immediately, either through a video chat or via the telephone, via the cell
But
phone.
I'm thinking more, how can they diagnose?
Well, let me give you
by
some
looking at you.
real life examples. The video call is a face-to-face visit, very similar you would do if you went to your primary care physician. You're going to stand face-to-face, look at the physician, going to ask you what your symptoms are, why you're there, what are you presenting today to me to diagnose. We do exactly the same thing with the exact same physicians that you may have anyway. Let's say, for example, let me give you a recent case that happened. My bookkeeper came into my office one day. She could barely speak. She was very, very sore throat. I said, "Why are you here?" And she goes, "I know what I got. I just don't have time to go to the doctor. I'm sure I've got strep throat." I said, "Well, why don't you use the telemedicine, because we furnish it to all of our employees." And she goes, "Well, I never thought about that. I have strep throat. How would they diagnose it?" I said, "Ask the doctor." So she goes, "Okay." So she went away. She went to her office for a few minutes. She come back. She goes, "You're not going to believe this. I have strep throat." And I said, "Yeah, we already knew that." She goes, "He's already sent a prescription to the Walgreens around the corner. I'm going to pick it up in just a few minutes." Done. I said, "Do you mind telling me how he diagnosed that you had strep throat?" She goes, "It was really simple. He had me open my mouth and use the camera to see my throat." And he goes, "Yep, I see the white spots on your tonsils. You have strep throat, and here's what I'm going to do." Done. She never left the office. In a matter of 5 minutes, she was diagnosed and got a prescription.
And how much did that cost her, Steve?
Zero.
Sarah, wow.
There's no copay, no deductible.
There's no copay, no deductible. There is no limitations. You can use it every day. You can use it for every person in your family. There's actually There are no limitations to what we do. It's unlimited.
It's
And-
healthalliancenetwork.com.
Yes.
Healthalliancenetwork.com. We're going to go to a quick commercial break. When we come back, more with how you can get involved. You can subscribe.
Yes.
Subscribe to Health Alliance Network, and we will be right back.
It's pretty cool. Thank you.
And we're back. Healthcare Thursday, our second segment. Our first segment was with Paul and Jordana on travel, and we've got them on camera 3 with Rocco, who will never come on camera. So
He
thank
did
you,
today.
Rocco, for
Look at
joining
Rocco.
us.
Okay,
He didn't
Rocco.
know. He didn't know he was on camera.
We
You
got
should've told
Rocco
him.
in the house.
Yeah, he knows. He
Who
sees the
changed our
camera.
mobile only to find out that the vent's been closed. You tell a 51-year-old woman the vent's been closed for a year? Maybe I'm not so crazy. How about that? A little crazy.
I
Just
think
saying.
you're a lot crazy.
A lot crazy. We've got Health Alliance Network with us. We've got Joe and Steve. And what you're talking about is truly amazing. So for $35, the whole family can be part of this telemedicine program.
That is correct.
So, for example, it would be Dan, his wife, his children have access to all of your board certified physicians. They're not nurse practitioners, they're not medical assistants, board certified physicians for telemedicine. How do you get paid though? Do you bill insurance?
So the great thing is we are not an insurance company. So we get paid from people being members in
Just the
our,
membership.
in our network. That is correct. Obviously, there will be fees to us for our utilization rates with our doctors, depending on how many visits people have or what happens during the month. During the flu outbreak last year, our utilization rises a bit for obvious reasons. A lot of people calling into the network. We handle thousands of calls per day. There is a second and third and fourth item that I should mention with this plan. So aside from the unlimited medical that you can get the doctor face-to-face, we also provide unlimited dermatology services. Now that works a little differently. If you see something on your body that is suspect, take a picture of it from 3 different angles. You would upload it to your profile, and you will get a written diagnosis from a board-certified licensed dermatologist on exactly what it is. And it's very simple. It will be one of 2 things. It's a freckle, it's a mole, there's nothing to worry about, or it's suspect. We recommend you getting in to see someone and get it treated or checked out a little further. So that gives you instant peace of mind knowing that within 24 hours you will get a diagnosis, because good luck getting an appointment with a
I
dermatologist
really like
in
this
Florida.
third one, this counseling, because
Yes.
a lot of times you need just somebody to talk to, right?
That's correct.
And you have this lost grief support, financial depression, and there's no extra fee.
There is no extra fee whatsoever. Just to be clear, all of our programs are unlimited use, unlimited telemedicine through medical visits.
And then I won't get a
Dermatology.
bill
You're not going to get a
from
bill.
the doctor
You're not going to get a bill from the
afterwards.
doctor. You're going to talk to a certified, U.S. certified board certified physician, just like you would talk to any family doctor, and you will not get any additional call. It's a flat, any additional cost whatsoever. It's a flat fee. It works just like a gym membership.
And on the counseling, who am I speaking with? A psychologist or?
You have your choice of a psychologist, a psychiatrist, a clinical social worker, a behavior specialist. In fact, if I can talk about an event that just happened yesterday, something that is of grave concern to everyone, especially here in Florida, is mental health across the country. But in
Yeah.
Florida, we're closer to a lot of events that have just happened. We met with a very large city yesterday here in South Florida. I won't give them a shout out, but we met with a very large city yesterday. They are going to subscribe to our service specifically for one thing, and that is for the mental health side of it. Because they said our first responders often experience very emotional and tragic conditions that has a lifelong impact on them. And we want to be able to give them a counselor, and they believe that our service would be much more effective because you can call on your schedule. You don't have to get in your car, make an appointment, and go see a counselor or a psychiatrist or a behavioral health specialist. You can pick up your phone 24 hours a day and speak with a counselor.
The whole city subscribing for not $35 a month.
No, they're getting a reduced rate, but I can tell you this, they're getting the same rate that any other employer that's listening to us today would get, as long as they have 3 or more employees.
Well, this is what I was going to ask you. If you have a company, you're starting up companies, we have a lot of startups that come in here.
Right.
And one of the things that you want to do is to retain your employees.
Yes.
They don't offer medical. I mean, everybody says go on Obama and buy. That's what happened to Freddie.
correct.
They don't offer medical. But this is ridiculous. Because you're giving somebody at least a chance. Not that you guys are going to cure. We talked about appendicitis and you may have to go see a doctor, the thing with the skin. It isn't that stuff, but I mean, I would say 80% of what you go to the doctor for with the cold.
That is exactly the number. It's exactly the number.
And the time savings for
Well,
anybody
you take-
to go there and sit in a waiting room for 2 hours.
Well, you take
and
me.
Find out, oh, you know what, that's just, go and take this. That could have been diagnosed by the doctor that they have and taken care of it. You would have to take the day off from work. I mean, you talk about what financial savings you have, the time savings to have to take the kids.
Well,
That's a lot
take me
for
for,
elderly people.
but you take me
Yes.
for instance, right? I have to go see my doctor because it's time for me to get my A1C checked, right?
Right?
And I take a shot of insulin in the morning, and they want to take me off of it, so I gotta have this test done to see if we're in the range. So I can't get metformin, and I can't get my insulin, and there's some other preventive stuff that they get. I can't get nothing right now.
Right.
I am on lockdown. To go to my doctor, it's the whole day.
But you still
That's what
have,
I just said.
you have to get your labs done.
Can't
You
do
gotta
that
get the
without
labs done.
getting
So,
it
but once you get the labs done, good luck getting a
Yeah,
doctor.
children cover.
The lady says to me, okay, come in at 9 o'clock, Freddie. And here it is, 12 o'clock, and I'm still waiting because if stuff happens, you gotta wait.
Can the doctor refer for a lab?
Yes. Doctors can refer you for a lab if deemed necessary. It's very interesting. Let me address something you just said. Our average wait time to speak with a doctor nationwide is 6 minutes. Pick up your phone, and I want to speak with a doctor because I have some condition. I feel like I'm getting the flu, an allergy, a cold, or something, whatever. Like you said, about 80% of the reasons that we normally go to a family physician for, we can diagnose and treat.
Yes.
It's really, really interesting, and the wait time is amazing. Let me give you another story, because we hear stories from our members all the time. One of our members called me the other day, and she said, I didn't believe it until I used it. I believed the story, but now I've used it, and I'm probably going to be one of your greatest promoters. Let me tell you what happened. She goes, I wasn't feeling well, so I called the doctor. We did a video chat. He diagnosed me with an upper respiratory infection. He sent a prescription to my pharmacy, and she goes, and then a few minutes later, after that was over with, I got a secure message on the app, because the doctors can talk to our patients on the app. I got a secure message from the doctor that said, I've looked at your case a little deeper, and I want to chat with you one more time because I believe I want to also prescribe an inhaler for you, not just the antibiotics. And she says, first of all, it took me 7 seconds to talk to the doctor.
Yeah, she didn't wait 6 minutes. It was
She didn't wait
instant.
6 minutes. Answered in 7 seconds. You go into a waiting room. You go to a queue while you're waiting for a doctor, or they'll call you back. Either way. She goes, 7 seconds, I talked to a doctor, and she goes, let me tell you what has never happened to me in my life. A doctor has never once called me back.
Yeah.
Your doctor called me back and said, I want to do something more for you. And let me tell you something that's even better than that. We have gone to the extreme with this. We have done a lot of research on how to get free prescription medication. Even insulin medication can be free. We have on our website.
Really?
Yeah.
My
Whoa.
ears just perked up.
Do you know how much I pay for my insulin?
Do you know they can even help your dad?
$223.
Try $310.
$2,310. That's what I
It's
said.
ridiculous what they
Yes.
charge.
Yeah.
It's unbelievable. It is unbelievable how much medication is. We have a list on our website. We did intensive research, and we do it daily. We update it daily. We have a compliance department. We went out and we found a list of every pharmacy in the United States. We first started out with every pharmacy in the United States. We wanted to see what prescriptions, if any, they offered free. Well, that list was crazy. So it just narrowed this down to about 10. Who has 10 or more pharmacies? Well, that list was crazy.
That was huge.
That was huge too. So we started delving into it, and now we have a list of thousands of pharmacies on our website where you can get free medication. It was interesting because the story I did yesterday with a city manager of a big city in South Florida is on blood pressure medication. And she said, I have to get my blood pressure medication. It's ridiculous. I have insurance. This is how much it costs. I said,
Linsipro,
just
right?
for fun,
Yeah, Linsipro.
let me run it through our app and see what we can get your blood pressure medicine for. Now, I already knew how the story was going to end because I did the research. The story ended like this. I personally called 12 local pharmacies in the Palm Beach County area. For that particular medication, it just happened to be that way. I called personally 12 pharmacies. I need my prescription filled. This is what it is. If I pay cash, I do not have insurance, how much will it cost me? Wide range, $0 to $223 without insurance. So I have my choice. I can either pay
Zero
zero
to $223.
or up to $223. Obviously, I chose to pay
Crazy.
zero. And I told her the story, and she goes, is that, I live in West Palm Beach, and And I said, you work all the way downtown? She goes, 78 miles away. I said, all right. I said, let's try it. Let's run it through our app. So she put her medication in the app, and it came up. And I said, how about Publix next to your house for $0?
Free.
Now, is that a generic?
Generic.
It is generic, okay, but we want to be, your phone went out. We want to be clear on this because when I was at Walmart picking up at metformin, lady comes up to me and Linda says, you know, you can get
Maybe
that,
lost internet, I don't know.
you can get that from
Free
Publix for
public
free.
at Publix Metformin.
And I have been paying for it, right? And I said, really? And I showed her the other stuff. And you can get this for free. This lady knew everything, like this guy, he knew everything.
Well, people are asking Nadine with David, who's got Duchenne's, what about cancer meds and muscular dystrophy? Can they run any meds through
They
your
can
app
run
and see?
absolutely any med through it. The generic meds are going to be considerably less expensive than name brand medications, but any medication all can be run through our application, yes. And that's a free service. We do not require, I want to make everyone know about this, we do not require you to be a member of Health Alliance Network, or be a customer of Health Alliance Network in order to enable the free prescription services. You just go to our website, healthalliancenetwork.com, click on the free prescription benefit plan, and you will be directed to a page, and we update it constantly, of where you can get medication across the country.
Check
Seriously?
it out. All right,
that's a
you
gift.
do
Holy
not,
smokes.
Freddie,
That's a
you
gift.
do not need to be the $35 a month subscriber with Health Alliance Network.
That's
You can
family.
just utilize
The free
the
prescription
free
benefit
prescription
program,
benefits and
yes.
just go to healthalliancenetwork.com, click on the prescription link,
Yes.
and I guess you put in your zip code and it will
You
come up in
sign
medications.
up.
Just
You
walk
can sign up.
And
yourself
you knew
through it.
about this? What's the matter with you?
I got a lot of things in my pocket.
$35 to be able to
Sure.
talk to.
Well, 35 is a
people
family,
and
right?
be able to
For a
have-
whole family.
But
Freddie,
an
yes.
individual is
Covers your
15.
whole family.
No,
That's
no,
amazing.
$35 for the whole family. Employer groups is 15.
Ah,
Employer
employer-
pays.
oh.
The reason we can reduce it to 15 is we're only collecting from one person that's paying for 3, 4, 5 employees.
So if I have 10 employees, let's say I have all my interns and I wanted to do this, it would cost me 15.
$150.
Nadine, I want you to check this
Wow.
out. She's telling me she spends $135,000 a year on Emflaza. $135,000
135.
a year.
Now we can put that into the app to see if there's something cheaper for her and everything.
Oh, my goodness.
I mean, this is just phenomenal
EM.
stuff.
They're going to
Steve is
check
on-
it out for
Steve
you,
is on it
Nadine,
right
right now. EMFLAZA, $135K a year for this medication. Nadine, I can't even breathe after I just saw that.
EM what?
EMFLAZA. This is truly amazing. And let me ask you, there are physicians who are, I remember when my husband was training, he was looking to do moonlighting because I had stopped working, having kids. How do you get physicians? What if a physician wants to become part of your panel? Is that an option?
There's an option on our website to join our team, yes.
And how about insurance? Are they covered under their own insurance?
I'm not clear on the
If an
question.
insurance physicians, just legally,
You're talking about
physician medical malpractice. There
Yes,
you go.
medical malpractice, yes. They have to furnish us with their medical malpractice insurance policy. In addition to that, we also carry what they call a malmed policy and a general liability and professional liability policy.
Think about how
In addition
great
to
this
that-
would be
Do
for
you-
my dad.
Well, hold on a
instead of
second. Do you have to be a
driving 30
board
miles.
certified doctor?
Yes.
Yes.
So if you're not a board certified doctor,
No.
you don't qualify.
You're not
That's
qualified.
correct.
You
For
can
my
qual-
dad, right? Because you work with children.
We work with children.
My
absolutely.
dad's a pediatrician. He
Yes.
makes house calls from Miami
Great for him.
up to Daytona Beach.
He doesn't have to know.
Now he could do this,
He
right?
could do it from his phone.
How much better
That's
would
correct.
that be for him?
Fantastic.
Now,
From the
you guys-
comfort of his own home.
Now you guys cover Puerto Rico.
Yes.
We do.
Oh, baby. I'm going to tell you
You
something.
know those pills your dad was talking
Yeah,
about today?
you're
Those
reading
white
my
ones
mind.
that he can't figure out what they... There you go.
It's unbelievable. And it's funny because in Puerto Rico now they came up with a phone service that goes through the electricity because there are no wires
lines
for the.
anymore, right? Yeah.
So they're doing through electricity.
That's
So
amazing.
I can work my phone when I go see him now. And oh, this is going to be an interesting.
How long have you... This isn't new, right? It's been at least 5
Th-
years or
uh,
something
this
that's
is-
on the
this is-
website?
This is not new. Let me tell you a little bit about us. We
Yeah.
are in the healthcare business already. We are other healthcare companies services 26 states. We serve the aging population for Medicare, Medicare A members. We service them through chronic care management conditions. So we've been doing that a very long time. We also own home health agencies here in South Florida, which is, we also service chronic care conditions, wound care, IV, all those things. And that is not under Health Alliance Network. I'm not doing a pitch for that. I'm just telling you about our experience. A few years ago, we had a mission, and that mission was everyone in our organization, and that was to bring better access to health care for everyone. And there's no better way to do that. We're taking doctors to people that can't get to doctors.
Yes.
It really started out as a rural healthcare project for us. I'm from Kentucky. I was born and raised in Kentucky. I was meeting with the Health and Human Services Department up there about how can we help you bring rural healthcare service to Kentucky. They said, we will use our Medicaid dollars if you'll open clinics and even open them one day a week and service some of these rural areas in Kentucky. So I got to looking at that and I thought, I said, I bet you Kentucky is not the only state that has this need. And then I started looking at Florida. And I spent a day in a city just west of here called Immokalee, Florida. I went over there. It's a city of about 25,000, primarily a farming agricultural community over there. There is not one clinician, not even a nurse in that town.
Wow.
That inspired us and me to launch this project called Better Access to Healthcare. We also have a nonprofit called Better Health, Better Planet, because we believe that if we can improve your health and well-being, that we will generally have a better planet.
This is amazing. I mean, Jordana, this is everything you do and not do, right? But it's right up your alley of,
Absolutely.
of going beyond and helping people and everything we do every day about
No,
sharing the
there's so
message
many
and the
facets to
information.
this, and I just can't believe how many people, the service you provide, the information you provide, the convenience that you provide.
Convenience is
you're
huge.
hitting a lot of, things that are on everybody's list, and, we have such busy lives that we lead, and people can't just keep taking off of work for something that, people are actually going on the website to have it diagnosed by people that might not be knowledgeable, and here
Yes.
they can go.
Well, no, they
to somebody
diagnose
that's
themselves.
certified. Well, this is the thing,
Right.
and it's not doing them any good, and it could be very dangerous. And
Very
here,
dangerous.
they can, in less than an hour, find out what it is.
Way less than an
get
hour.
it, I'm like,
So you could, your
going
feet, you
higher.
can sit with your
you
feet
can
up on the
still have
couch,
your-
yes.
You can still go to work or whatnot, find out what it is, go get your prescription, take care of your family, take care of your business, and take care of yourself. And I just think that
Think
what
about
you're
your
doing is
children, right? When
incredible.
your kid's got
Oh
an
my
ear
gosh.
infection and you got to figure out nap time versus getting to the doctor and getting home
Yes.
from work, and you've got other kids.
Yes.
You have to take them all to the doctor to be able to do this and diagnose an ear infection or something, a sore throat, things that are basic, a rash, eczema, diaper rash, a lot of the things that you have to go for.
You no longer have to leave your
You
home.
don't
And
have
does
to
this
leave your
also
home.
expedite the referral process? Because I know
Yes,
that
it does.
I
Yes.
know you guys. So I was skiing and I tore my ACL on one of the last days of my ski
Ouch.
trip. I know, really big ouch. And I had to wait a long time. I was going to wait for the doctor anyway, but the referral process for a lot of things, having nothing to do with my ACL, is quite long. They have to wait. You have to have them call, and okay, we'll get back with you. And it sounds like this expedites that as well, which
Correct.
is a huge plus for anybody.
Sarah Allen's a nurse. She says this is a game changer.
Yes, it is.
It is.
And it is a game changer.
Yeah.
And it's really funny because everybody thought when Obamacare came out, that was going to be a game changer. And it's really the millennials in college that are paying for that plan because they don't go to the doctor.
They don't go to the doctor.
They don't, but they end up paying for this service and not using it. And because now they're beginning to drop off because the expenses have gone through the roof, that whole plan's about ready to crumble if it hasn't already. But this is really unique for a lot of different reasons. New companies that want to retain employees at $15 a month is not a big hit. This is ridiculous.
It's a no-brainer.
It's a no-brainer. If you don't do it, there's something wrong with you.
Shame on you, right?
And there's something wrong with Dan because Dan, he told us about you a little bit. About,
Something wrong with
he
Dan
just
here.
mentioned you were his brother. That was really it. But this is unbelievable.
Yeah, thank you, Fred.
It's
Unbelievable.
incredible. Let's go to commercial break. When we come back, more with Health Alliance Network. Go to their website, healthalliancenetwork.com. You can also find them on their Facebook page. You have a few because I've looked for them. Health Alliance Network, there's LLC, and there's Health Alliance Network. This is amazing, $35, and check out the free pharmacy plan. You don't even need the membership. We're going to take a quick commercial break, and we will be right back.
I didn't know you were waiting for
Thank
me.
you for watching the
Peter
Brooklyn
Coffee.
Cafe
I went
TV
in
show.
there to tell the interns, which are all millennials, that how many of you go to the doctor? And none of them raised their hand.
I just have to tell you, we don't even
I asked you. Okay, who goes to the, okay, Sopranos, you go to the doctor? No, you told me you were sick, yes. Yeah. You go to the doctor?
You FaceTime your doctor?
You FaceTime your doctor?
FaceTime my doctor.
Go sit next to Jordana. We'll get you on there.
Come on.
You know, the thing is,
Come
we can't
on
even
down.
cover the benefits of this. I'm even back to the counseling aspect when your kids are in college
Yes.
and
They're covered.
and they're having breakdowns. But
They're
because
covered.
the counseling centers at these schools are so overwhelmed, with
What
the amount-
counseling center?
they exist, but you can't get an appointment with the counseling centers
Good
for
luck.
3 to 4 weeks. right? So you've got a kid in crisis, a college student in crisis, and they call. You're either going to go to the hospital 911 because you can't handle anything and you're a danger to yourself or someone else, or they say we can get you in 3 or 4 weeks. At that point, you can't even function. But this, you can call for the counseling services right there within minutes and have somebody to talk to.
That's
And
correct.
that's just on the basic level.
Do you-
Prescriptions,
do
everything
you ever
else,
get
that's
sick?
enormous.
Do you ever get sick?
Never get sick?
Yeah.
Yeah.
Of course.
You go to the doctor?
No.
She FaceTimes.
Well, hold on
Why?
a second.
My mom's a nurse, so
Well, hold on. Listen to her answer.
Can your mom prescribe?
I don't really need prescriptions.
Okay, do you ever go to the doctor?
Besides, like my eosinophilic esophagitis.
Okay, you heard what you got?
Yes.
That was confusing. Do you ever go to the doctor?
Yes.
Or you do go to the
I go to
doctor?
a specialist and I go to a primary.
Okay. I just wanted to know because my kids never go to the doctors.
And I get my flu shots.
You know, they offer me that too. I have
Smart.
never taken one of those either.
Thank you.
Now, let me ask you, my son who's watching all of a sudden, he has a newborn, he's 4
Yes.
months old, growing.
Yes.
What service, he pays, my son pays $1,700 a month for his family care.
If I was him, I would suggest that he visits that
He's new.
again, revisits what he's getting for his $1,700 a month.
Yeah, and his deductible is 15 grand, I'm sure.
That's
as well.
right. How'd you know that?
It's just
I'm
fascinating.
in the
When,
same pool.
when I worked with my dad, he's a pediatrician, and telemedicine was just coming out then. He had this idea, much like yours, but to get this off the ground, needed help to get this off the ground.
Millions of dollars.
And what you have created for both, for the board certified physicians, I need lab work done. I called one doctor. I got the MA. I'll call you back. Took 2 weeks. I called again and again. We'll do 1 year labs. Why won't you do them all? We need to call the other doctor who changed your medicine. Why can't you just stick me once and run them?
Total
Exactly.
broken
No.
system.
I mean, this is crazy.
We call it pay to play. Is
Yeah.
really what it is.
That happened to me.
And I'm even happy to pay. I didn't even question the price. If you're going to take my blood, just order all the labs. I will pay. I'm not even questioning the
Yeah, but you
payment.
got to
Just
come
do
over
it.
and over so they can get paid again and again.
It's
That's
Exactly
correct,
right.
Freddie. Yeah.
That's what
But
just
you
happened to
can
me.
work with kids and ear infections. My question for seniors, you work with seniors.
Yes.
How do they get on the app? Is there another way?
There's several ways
Several
to use
ways.
our service. You can do it from a computer if you like. You can do it from our app from a phone, or you can make a telephone call. It
Okay.
does not matter. Oddly enough, we thought the app would be the most practical adoption of our services. The telephone is the most practical.
I was
People would
gonna
rather
think,
just talk to the doctor. And the doctor will go through an interview process. Why are you calling today? And I've got a headache. How long have you had the headache? Same thing you go through when you're face to face with the doctor. Exactly the same.
For seniors who know how to use the cell phones but don't understand the FaceTime or the apps or the computer camera, you have a
It
way
can
for
be
them to access
overwhelming
you.
For them, and
We-
this makes it gives
My
them
nana
that other
texts.
option. to
We
got
make
them
it
covered.
easier.
This is just a phone call.
Pretty great.
Well, the funny thing is, we're going to invent an app that you hit. Can your finger hit the screen? If it does that, it takes you right to whatever you got to do. Because
Wait,
here
I
you're
feel
not
like
asking
I don't go to a corrupt doctor, so maybe if
corrupt doctor.
We're not
Yeah.
saying that at all. It's just you're looking.
Sopranos. Nobody said anything about a corrupt
It's
doctor.
just it takes away
Yeah,
time out of
but
it.
I get everything done at the same place. Like I don't gotta go to 100 different doctors.
Yeah, but imagine if you had 3 children and one had an ear infection, you had a full-time job, your husband was working, your partner was working, and what are you going to do? You got to take off work.
You put vinegar and water in the kid's ear.
We use
That's
white
your
wine
ear infection.
She's a walking app.
You've got your baby has hand, foot, and mouth, right? You've got rashes.
Throw
You've
it
got
out
a
a
screaming
window.
baby. You've got all
Painful.
these things.
He has his hand
Very
in the
painful.
foot in the mouth.
Trust me, you don't even want this disease.
Oh, it's the
Yeah.
thing. Oh, that's what Syndergaard
It's like
had.
It's
blisters
rough.
Isn't
in
it?
your
It's rough, yeah.
But
mouth.
look what happened to me. I went to my cardiologist and had blood work done, right? And then I said to her, "Did you want my diabetes?" No,
Why not?
because she says
It's
that's what
common
he
in
has
Another
to do.
mistakes
doctor,
all the
another
time.
Why
visit.
don't you
Yeah.
have a primary that does everything
But wait a minute,
for
it
you?
gets better. Then I gotta find out
Because
that
you're young.
I have to go back to have my A1 done
Yep.
Yes.
at the end of September. Because you have to make an appointment in this cardiologist's office. I said, "Are you serious? Give me a break. One visit, get it all done. How much gallons of blood do you want?
Why
Just
would
get
your
it done."
cardiologist take your A1A? It's not your diabetes doctor.
Because when you have
Stick it once and just do it all.
because when you have diabetes, you got to be careful that you don't have a heart attack. Because apparently, diabetes, you're a prime suspect for a heart attack. So they run all this heart stuff.
Yeah,
you
but
have no
I'm
idea.
saying
You should see the
The
test
heart
they.
doctor, you shouldn't expect your heart doctor to take your A1A.
Yes, you should,
Yes,
because
you
it's
should.
one, should just be one lab, one
Because
visit.
for
Why
the
do I have to
doctor-
go to 2 separate doctors?
But why would there be specialists then?
It doesn't matter who reads it, honey. I'm just saying they have to done the
It's going
test.
To have the
lab.
blood drawn.
And
If it's
you
going
maybe
to a
should
lab,
Ask
get it
before they
done.
draw the blood if you could do the A1A as
No,
well.
she said
They
you
don't
gotta go.
want
You
to.
had to go to him because I want him to do it. So I got to pay again.
But you all-
you
even
should
offer
find
the
a doctor.
physicians, if they need to order lab work, and we were talking about this at commercial, we'll order the labs for the patient. The patient then gets a copy of the labs. Wouldn't that be nice if you had that?
I do have a
It
copy.
goes back to the
somewhere.
physician that you spoke with, and they look at it and say, all right, this is good, this is what we need to work on, and then you get the follow-up,
That's correct. That's
which
correct.
is absolutely incredible. So it's not just once, you will get the same physician that will contract back with you,
That's correct.
contact you again.
That's
Yes.
correct.
HealthAllianceNetwork.com.
But the bottom line here is that the money you pay here, that's about, I don't know, I can cover maybe 5 doctor visits with this 30.
No, you can't.
I mean, 5
5
times
visits.
this
Oh,
Right.
yeah.
would be 1 doctor's visit when I
Oh,
finish
yeah,
with this
right.
doctor.
Easy.
So if you look at the math, a lot of people like me don't go to the doctor because I don't like to go, but then you have to pay, and then you have to pay again. And you gotta every time I go in there, I don't know what my deductible, my copay is gonna be, right? And then
You're
they're
always
adding
on the
up.
blind, Freddie.
You're
Always on the blind.
And the
Yep.
guy says, okay, you owe me 80, you owe me 50, you owe me 60. This is like a pinball.
And what do you do, Fred?
I
You
give him
dig
my
and you,
debit
that's right.
card.
And you
But
pay.
you know what? There are times when you need to go to the specialist. You need
Yes,
your EKG.
yes.
You need those tests. If you
Different
have
story.
appendicitis, you have to be seen. But for your basic bread and butter things that you don't want to take the time off, I still go back to the screaming children waiting in the pediatrician's office, or a senior who's got limited mobility.
The
The-
like daily things. That
You know,
are
the
not
limited
like-
mobility
That
to
most
get
people go
someone
for and
there.
take up the time.
That's
The
right.
basic things that are coming.
I mean, if you crack your head open, that ain't gonna help you. You gotta
You
go
fall
get
on a
some-
No,
kitchen
no, they'll
knife,
put you on
yeah.
face. You pull your head open, they'll look if there's anything.
Says, do you think this bleeding thing needs stitches?
Well, let me ask you that. If you have a cut and a laceration and you're debating, do I need to go get stitches and sit in ER urgent care, or
Funny
can
you
I
should
just
ask.
Band-Aid
It's
it?
good to ask.
That recently happened.
That happens to us with my son all the time. He's 23. We get FaceTime at midnight.
He got
What do
his
you
nose
think?
broken.
But is that something else that you have a physician that will look at that and
Yes.
say,
Yes, that recently happened with one of our members. It was a female, and she cut her foot, and she's like, "Oh my gosh, I don't know if I need stitches." And she went on our app, and the doctor told her, "No, it looks good." Told her what to wash out, the hydrogen peroxide, what to do, blah 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 blah. Butterfly it, and you're good to go.
Now that's funny because
Amazing.
if a kid walks into your phone, you know, he's on the phone, and your nose instead of being this way goes down, you know, to Iowa. Yeah, I think it's broken. Now you can snap it back in place, right? It's gonna hurt. Your
gonna
eyes
hurt.
are gonna turn black. You're gonna cry like a baby. You can do that, or you can go to a doctor and he'll do it. Anyway, it comes down to.
Right.
but we're thinking about stitches, not needing stitches, how deep is the wound? That's something else that saves you from the ER visit. That's not even a doctor visit. That you go straight to ER urgent care. And you can
Exactly.
wait and triage for that versus everyone else for hours.
So many
Yes.
times you don't know as a parent, and it's just nice to be able to have that very quick
And
Exactly.
response.
peace of
and
mind.
ask somebody,
Peace
right?
of mind.
And then you know the next steps.
Yes.
And I love
And
the
then you can take that.
the college
You
aspect
All right, listen,
take the phone
be-
and you go,
Before they leave, so Rowan is 4 months old, right? Do you guys deal with children,
Pediatrics. sure.
pediatrics
Yes.
and stuff
Yes.
like that?
Yep.
The
I'm
app
gonna get
is-
my dad a new job.
The app is
Yes.
intuitive. If you have children under the age of 18 and you go online and you select, it asks you which patient are we seeing today. We're seeing little Sammy, and Sammy is 6 years old. It's automatically going to redirect you to pediatrics because you
You
don't
won't have
need
a
a general
choice.
practitioner. You need a pediatric because it's a 6-year-old patient being presented here. It's an amazing process what we do.
What
We
you
are-
do is, 79,000 views we already have on the show today.
I know. You know, but the bottom line here is, again, Dan. I'm going to point at Dan. This is
I'm
something
always
that,
get blamed for everything.
but this is something that really you guys have to make the tour and get this stuff out
We do.
We're happy to
across
be here.
the
We're happy
board
to be here,
because
and we
I
will.
mean this is just ridiculous. And there's so many other groups that my phone is blowing up. I have to put it away.
Freddie, allow me just to say one very important thing because I know we're wrapping up to the end. This is a great statistic. Just over 90% of all our patients that visit our platform result in cure. That is a gigantic
That's
number.
huge.
Less than 10% are referred out of the network for further services. That's a tremendous number.
That's good.
So fair to say, most of the people that visit our platform and visit our doctors came, they got what they need, they got diagnosed, they got well, and they're on their
You
way.
think about employee retention, right? And loss of work hours and job time. You're not spending the time going to the doctor. When you said in your office,
Yeah.
she had strep, she stayed at work, she got diagnosed, she got a prescription, and she'll be back at work.
Exactly.
Amazing.
I don't want to correct Joe on air, but I will. He said over 90%. We just got our report back from Cigna, who
Be
did a
nice.
separate independent study.
93%.
97%.
No, 97. I knew it. I knew it, but I didn't want to cite Cigna.
He didn't want to say it.
I didn't want to cite Cigna.
97% of the phone calls made to doctors result in case closure. Diagnosed,
That's
symptoms
amazing.
diagnosed.
That is
resolved.
phenomenal. That's unheard of.
It is unheard of.
Incredible, isn't it?
This is really interesting. And when I said it last night, actually to our CEO, I said during another presentation, I said, we are not an insurance company. We don't operate like an insurance company. We operate completely different. Insurance companies don't want you to use your insurance. When's the last time your auto insurance company called you up and said, would you go out and have an accident so you can make a claim?
Who are you?
Who are you?
Yes.
Would you use your health insurance, please? They don't want you to use
Nobody
your insurance. And then if you do use your health insurance, they penalize you. Like you were saying,
Yeah.
I go and I pay 50, 60, 80, and then I get a bill at the end of that, and another bill
Yes,
for another
it's just
$100. I don't know
ridiculous.
What's this money for?
We
We're completely
encourage.
different. We have a very strong member engagement program. We are always reminding people, you've got telemedicine, use it. You've got it, use it. Some of our campaigns, a recent campaign we did in August, back to school, back to germs, alerting people to say,
Yep.
your kids are going back to school, be aware of those problems, and if you do have any symptoms, immediately use your telemedicine
Come to
app.
us.
We had another video broadcast we did that was called "Don't Let a Bad Cold Ruin
Ruin
a Good Day." It was a great one. We do a lot of community outreach programs
Very
to make
cool.
people aware of the
Very
process. Can I mention our Facebook page?
Yes,
I don't want
absolutely.
to step on anybody. You can visit on Facebook at facebook.com/Team Health Alliance. Facebook.com/Team Health Alliance. We are broadcasting this also live through our Facebook pages and some of our other channels. As you said, I see we have over 79,000 viewers online with your television
This
show
is
today.
truly incredible, and we are not saying don't see your local physician.
not saying that.
We're just saying as an option for $35 a month for those simple things you need, for time saving for children, for seniors who you can't get out to see the physician, for peace of mind, for even just triaging treatments for $35 a month. This is a game changer for ordering labs to get everything done in follow-up. Amazing time saver. When you see your doctor, the reason you pay your copay is to pay the doctor. We're not telling you not to go see your doctor and pay your doctor. Your copays are because the doctors need to get paid because your insurance companies are taking all your insurance dollars. So again, I just need to clarify that. We're not saying anything bad.
That's correct.
It's just this is another option, and please utilize it. And the prescription service to find out cheaper prescriptions in your area.
Come on
You don't
in.
have to be a member for the $35. It's a free website.
Well, she says that. I say if you have a business
Yes,
and you're a
Freddie.
business owner, you see this card? If you don't do this, you're a dummy.
What's the website,
Simple.
Freddie?
$15.
$15 a month.
Yes, Gio.
And it helps you retain your employees. I mean, just
Gio has a question.
yes, Gio.
Is the Facebook link called TPPA?
TP?
TPPA,
I'll show you the link.
No,
He was
sorry,
trying
it's
to get the
not.
link.
which is the link you
Team
want.
Health Alliance. Team Health Alliance.
Team.
Yes.
Team.
T-E-A-M.
I'm sorry. It's my Kentucky accent. I had
That's
it
okay.
removed, but it keeps coming back.
You sound like you're from the Bronx.
Team Health Alliance.
I talked to him too much.
Go
That's
to the
why.
website. It is healthalliancenetwork.com. You can find out all the prescription information there. You can sign up for the program. You just need really your name, date of birth, access to
Address,
medical records,
email.
address, simple email, easy.
Did you find out whether or not she can find
The North-
that?
She's
that
looking
kind-
all that. And also,
the
if you're a
prescription
physician
benefit.
looking to get involved, you get it on
Go
the
to our
website
website.
as well. All board certified physicians. So for everyone, it's a win-win for the physicians, for the patients, for their families. Dan, thank you. Businesses and employees.
Listen,
Dan, you know
Don't
what?
mention it.
listen.
It's been a pleasure having you on the show today.
If-
And now we can open the vent.
You're a man of many words. If you have a business, I'm going to say it again. Give these guys a call. Jump on this. It will help you retain your workers. Do you know how many businesses that I've had come in here and they lose their workers and then they lose their business? This is just phenomenal in
Very
Florida.
common.
And
It
when's
is
tomorrow night?
contagious. Art Walk tomorrow night, 6 to 9 or whatever.
This summer.
You guys going to be here?
We'll be here.
All right, we'll be here too. We'll be
Excellent.
live streaming from the event, 6 to 9 p.m. at Art Walk, 1440 North Federal Highway in Delray Beach. Thank you. This was amazing. Jordana,
Thank
thank you
you.
for staying. Thank you, everyone, for running the board.
Thank you,
We'll see you
Sopranos.
tomorrow, same time, same place. Be kind to each other.
And don't be late.
Bye-bye.
Bye.